So in this session, we are going to discuss the Unani systems of medicine from the chapter Indian systems of medicine. So let us move towards the introduction to the Unani systems of medicine. Mainly, the Unani system is originated in Greece. So as I have said that it is not originated in India, it is originated in the Greece and later in the Arab world. So it came from Arab world into the India. It is based on the teaching of Hippocrates and the Galen. Maybe you are aware about the Hippocrates, father of medicine, along with the Galen, who contributed for the development of the Unani systems of medicine. So this system is also called as a Unani or Arabian medicine or Islamic medicine. So Unani system of medicine, it is also known as the Unani or Arabian medicine or the Islamic medicine. So Arab like Razaz, Abyssinia, then Al-Zarawi, then Abni Nafis, and other elaborated this medical system. There are so many Arabs are there who contributed for the development of the Unani systems of medicine. It is mainly based on the teaching of Hippocrates and the Galen. The system was contemporary system of traditional medicine in Egypt, Syria, Iraq, Persia, India, China, and other Middle East countries. It is being practiced in the so many areas. The system of medicine was introduced in India around 10th century AD by the Arabs. So in India, it is being introduced by the Arabs. So it is originated in the initially in the Greece, then Arab world and Arabi. They have introduced the Unani systems of medicine into the India, and till today we are practicing the Unani systems of medicine. As the Delhi Sultan provided the protection to the scholars of Unani system and employed them as state employees and court officials. So the Delhi Sultan, who supported the Unani systems of medicine, which is being brought by the Arabs, and whatever the scholars are there, they are being appointed as a state employees and court physicians. So furthermore, 13th to 17th century AD, the duration was prosperous for Unani medicine. Furthermore, it is being developed in India from 13th to 17th century, and this system is being declined in British rule when they withdraw the state patronage of the Unani systems of medicine. Whatever the patronage, whatever the importance which is given to the Unani system of medicine, which is being removed by the British, isn't it? And the decline for the Unani system of medicine in India gets started. Furthermore, the efforts of Sharifi family in Delhi, then the Aziz family in Lucknow, the Nizam of Hyderabad, the Unani medicine was survived during the British period. So whatever the things are there are three families are there who contributed to survive the Unani systems of medicine in India, like Sharifi family in Delhi, Aziz family in Lucknow, and Nizam of Hyderabad. Furthermore, Dr. Salimuzzam Siddiqui, a chemist, carried out the chemical studies on some important medicinal plants used in Unani systems of medicine. So this is an introduction to the Unani systems of medicine along with the historical background. With this, let us move towards the principles of Unani systems of medicine. So let us see the principles of Unani systems of medicine. So in the case of Unani systems of medicine, body is made up of three proximal qualities. Which are those three proximal qualities? That is the four basic elements of human body, qualities or states of human body, and 4 humors of human body. So, in the case of Unani system of medicine, it is considered as body is made up of the 3 proximal qualities. These 3 proximal qualities are the 4 basic elements of the human body, qualities or states of human body, and 4 humors of human body. So the 4 basic elements of the human body, these are being earth, air, water, and fire. Then the qualities or states of human body are cold, dry, wet, and hot. And 4 humors of human body, that is blood, sputum, or it is also known as a phlegm, yellow bile, and the black bile. So as like Ayurveda, the body is made up of the 4 basic elements, that is earth, air, water, and fire, which have different temperaments. So as like Ayurveda, the body is made up of 4 basic elements, that is earth, air, water, and fire, and which is having a different temperament. Like there are 4 temperaments are there which are being considered, that is the cold, hot, wet, and dry. So these are the 4 temperaments. So after mixing and interaction of the 4 elements, for example, earth and air and water, water and fire and earth, there is a formation of a new compound having a new temperament came into existence. For example, hot and wet, hot dry, cold wet, and cold dry. So the body has a simple and compound organ which got their nourishment through the 4 humors. Furthermore, that is the we have considered the 5 basic elements of human body, which is made up, that is the earth, air, water, fire. These are furthermore made up of the 4 temperaments, that is the cold, dry, wet, and hot. Furthermore, there are 4 humors are there for the human body, that is the blood, phlegm, yellow bile, and the black bile. So humor also assigned some temperaments, as the blood is a hot and wet, phlegm is a cold and hot, yellow bile is hot and dry, and black bile is a cold and dry. Just see the image so as to you will get the idea about 4 basic elements of human body, then qualities or states of human body, then 4 humors of the human body. So whatever the Unani systems of medicine, these are based on all these principles. So let us move towards the diagnosis in the Unani systems of medicine, like Ayurveda or the Siddha system of medicine. Here also, in the case of Unani systems of medicine, the disease is being identified with the help of pulse reading and physical examinations related with the urine and the so main focus is towards the physical examination of urine and stool and the measurement of the pulse reading. Also, patients are examined systemically to make the diagnosis easy as a spot diagnosis with the help of simple and modern gadgets. There are so many modern ways are there by which also it is possible to diagnose the patient in the Unani systems of medicine. Unani system has shown remarkable results in a curing of diseases like arthritis, leukoderma, jaundice, liver disorder, and bronchial asthma. Furthermore, if you can see the image, you will get the idea about the certain parameters which are being examined, like volume, strength, velocity, then fullness, temperature, then rate, equality, consistency, regularity, and the reason. So in this way, it is possible to diagnose the patient in the Unani systems of medicine. Let us move towards the treatment in the Unani systems of medicine. In the case of Unani system of medicine, there are three therapies are there which are being considered. First therapy, that is known as the regimental therapy. Second therapy, that is known as the diet therapy. Third one, that is known as the pharmacotherapy. So in the case of regimental therapy, which includes the venesection, cupping, diaphoresis, Turkish bath, massage, exercise, and leeching. In the case of diet therapy, more specifically, we are focusing on the diet of the patient. Then pharmacotherapy, mainly dependent upon local available herbal drugs. Available herbal drugs are being used to disease and disorder. And last one, that is the surgery. So that is the incision and all those things which is being carried out in the surgery. So in this system, patients were treated with the diet, pharmacotherapy, exercise, massage, and surgery. The patient treated with the exercise, massage, touches is termed as the regimental therapy, that is the Ilaj bil Tadbir, while those treated with the diets are known as the dietotherapy, that is Ilaj bil Githa. Treatment which is concerned with the cause of disease is referred as a pharmacotherapy, that is Ilaj bil Dawa, and in case of treatment by surgery, it is known as Ilaj bil Yad. So it is one of the traditional system of healing and health maintenance observed in the South Asia. Mainly again, there is a much more contribution of the South Asia for the development of the Unani systems of medicine. The importance is given to nature of patient in the diagnosis and treatment of disease, and preference is given to natural remedies derived from the plant for healing the disease. As like a Siddha or Ayurveda, here also in the case of Unani systems of medicine, we are using some natural ways to treat the patient. The use of suitable diet and lifestyle used to promote the health of particular individual. So if we can use the dietotherapy, if we are changing the lifestyle, it becomes very easy to treat the patient. According to this system, primary four qualities such as a hot, cold, dry, wet, consider the entire universe, including human being, disease, drug, and environmental factors. So main thing which is being considered and discussed in the earlier, that is a hot, cold, dry, wet. That is the temperament. The drugs used are mostly of a plant origin. Some drugs of animal or mineral origin, they are being used. Patients are treated either by single drug, that is a fruit drug, or by compound drug, that is the formulations of the single drug. There are two types of compound drugs are used in the treatment of disease. There is a classical compound drug and patented or proprietary compound drug. Classical compound drug means which are used for 100 and 1,000 years. Whatever the classically or since ancient time, whatever things are available, it is being considered as a classical compound drug. Then the patented or the proprietary compound drug, which is being formulated and developed by the certain individuals or the institutions as per their research and the experience. This is about the Unani systems of medicine. So in this session, we have discussed an introduction to Unani systems of medicine, which is being developed initially, originated in Greece, furthermore developed in the Arab, and it is being introduced by the Arabs in India. Then principles of Unani system of medicine, then diagnosis in the Unani systems of medicine, and treatment in the Unani systems of medicine.